There we go. Well, good afternoon, everybody, and welcome to this month's staff chat. For those of you who are new to this series, my name is Priscilla Andrews. I'm the clinical manager here at the Cancer Wellness Center. The staff chat was created, I can't believe we're coming up on our 3-year anniversary, believe it or not, and was created as a way for people to have insight into conversations between professionals about topics of interest and concern to the cancer community. And I am very pleased to have today two of my esteemed colleagues, Elissa Siegel and Stephanie Aaron, to talk about pediatric cancer and the family. So Elissa and Stephanie, thanks so much for being here.
Thanks for having us.
And for those of you who aren't familiar with either of you, maybe you could take a moment to introduce yourself as far as what you do at the center, and also would be interested, as I think I always like to ask, kind of what drew you to this population. So yeah. Who's going to go first? I call it eye hockey.
I can go ahead. So as you mentioned, my name is Stephanie Aaron. I use she, her pronouns, and I'm one of the therapists here at the Cancer Wellness Center. And I got started working with kids. I've always loved working with kids in daycares, nursery schools, in different kind of capacities. And then through a kind of combination of personal and professional reasons, knew I wanted to work in the oncology setting as well. And so that kind of led me to my work here at the Cancer Wellness Center, and love working with kids and their families in a therapeutic setting.
Wonderful. Thanks, Stephanie. Elissa?
Yeah, hi, my name is Elissa Siegel. I am the Child Life Specialist here at Cancer Wellness Center. Child Life Specialist is a little different than a child therapist. So I focus on coping and anxiety reducing strategies. I provide developmentally appropriate information, and I do it through play and emotionally expressive activities to help identify what we're feeling and help move through those big emotional moments. I'm interested in working with kids since I myself was young. I definitely felt a calling to that population. And as I came from an education background and being a parent myself, I was in the healthcare settings too, and just really found child life specialists as just an amazing way to connect with kids. So that's why I turned to that profession, and working with children in oncology has just been a really special journey that I'm proud to be part of to help mitigate any stress that kids have. And so I'm very pleased to be able to do that here at the Cancer Wellness Center.
Well, thanks for that. And I have to say, I think I take a lot of pride in the fact that we have a child life specialist on staff, because typically that role is one that's found primarily in hospitals, and love the fact that bringing Elissa on board about 1.5 years, 2 years ago. How long's it been? Yep. That really grew our programming. And that's why we now have Stephanie, who is also such a valued team member. So it's so great to have you both here. I think to talk about a topic that, I'll say it tugs at the heartstrings, right? It's not the natural order for a child to be dealing with a serious illness like cancer. And yet that is the greater world we live in, and that's the world that we live in. And I think no parent wants to hear the news that their child has cancer. I can imagine the shock that families experience, and certainly the shock that I've witnessed. And just to jump in here, I think as parents are trying to get their bearings on that, I think part of what can come to mind is trying to figure out, how do I even talk about this? How do I talk about this with my child that has the diagnosis? If there's other kids in the family, how do I talk to them about it? I think with adult to adult, there can be hesitancy around the word cancer, that I think even with children, there being that like not wanting to use the word cancer, not wanting to frighten, being afraid that I'm going to frighten them. So I'm curious what guidance, when it's those early days, what guidance you provide for families about how to start talking about the diagnosis.
Sure, I can start and give you what I would advocate if you were to call in and want to know how to explain what's going on in your family to your kids. A lot of it, number one, has to do with the age of your child, the age of
Sure.
your other kids, because the conversation is going to be a little different for a preschooler than a school age child, and even to a teenager. So no, regardless what age there are, I always advocate for plain, simple language and to name what's going on. Say that your child is sick can be confusing, because most kids get sick all the time. And that's
Sure.
not what's happening. They have cancer. And even though that is a really loaded word for adults, most children, unless there is someone in their immediate household, a grandparent or an adult that they know that have cancer, really don't have the experience the way that we attach to the
Yeah.
word cancer. So first off, plain, simple language.
Yeah.
Yeah.
Any thoughts, Stephanie?
Yeah, absolutely. I agree with Alyssa, and I think her point that, most kids get sick, and to make sure that you're distinguishing between being sick and having cancer can be so important. Of course, for the older kids or teens, I think sometimes there's that hesitancy of, well, they're going to Google things. And I think the reality is they're going to Google things no matter what. And they're going to absolutely know what's going on, right? They can read the big old cancer center sign out front where they're getting treatment or their siblings being treated. They know when things are happening that are different than a cold, if their hair is falling out, if they're experiencing other things, seeing their sibling go through that. And so being able to be transparent about what's happening and creating a space where the kids know that they can ask questions if they have them and get an honest answer without having to turn to Google, where maybe that isn't the right answer, I think is an important piece of the whole beginning.
Like you want them to make sure that they're getting information from like a reliable source, getting accurate information, and that may not always be going to the internet. So wanting to make sure that open communication is there. Something that occurred to me as you guys were talking was also just thinking about that developmentally appropriate language, or just thinking about where a child is developmentally and how over time what their needs may shift as they age, or how they may revisit or experience their diagnosis over time. I mean, I'm curious. I don't know, that just popped into my mind as, you have a child, if say they're diagnosed when they are like early grade school and then they're middle school, high school. Can you speak to what that experience is like as far as how the child may like reprocess the experience or may need different information over time?
Yeah. You're covering a lot of developmental important years there. So um, let's just start with like that first piece of presenting information, right? So if you have a school-aged or a teenage child, you might use, some terms that may seem that they understand, chemotherapy, CAT scan, PET scan, MRI, brain scan. But that doesn't necessarily mean that they understand what you're saying. So even if you're an older kid, using the correct terminology is great, but then let's explain what that means. What is an MRI? What is a CAT scan? That's confusing terminology that you might not know unless you've been to the hospital already and in that, intervention. But going back to as you're growing in age, chronologically, you still want to take a look at where your kid is emotionally and developmentally. And sometimes when you're dealing with something that's so big and so scary, you really don't have to change too much because you're being gentle and tender and meeting them where they're at in this whole process. So yeah, as they get older, you might want to be more upfront about possible prognosis and treatment plan, but you still want to be pretty tender about how you're giving the information and back to that simple, plain language. As your child gets older, it's normal that they turn away from the parents for social and emotional support and they turn to their peers, but that doesn't mean you're less connected, that you're less in touch. It just means that you widen that circle of support for your child, and there's trusted adults in school, there's trusted adults, excuse me, in after school activities. So, you're still keeping that bubble, but it's extending as your child gets older.
Mm,
Yeah.
mm,
And then I would say I always advocate, as your child gets older, to use going back to the oncologist or the doctor as a good time to check in, a natural time to check in as they're continuing to understand their experience differently. As we're going to be seeing your doctor today. Are there new questions you have for them? Do you want different information? Do you want to hear again what kind of happened, even if they're not necessarily in treatment anymore? I think it's a good time to check in about what's your understanding of what you've been through, and do you need to hear it again, or do you want to hear things differently?
yeah, yeah. And it's sort of that built-in check-in period.
Mhm.
I think that idea of the child's understanding of their diagnosis, I think there's a lot of magical thinking that children can have, and that thought that, maybe the parent is hearing that the child thinks that they caused their diagnosis, or maybe the siblings are afraid that they're going to catch the cancer. You think about I think to your point, Alyssa, about the need to use the word cancer, because sick is something that you can catch a cold, you can catch COVID, you can catch the flu, right? But that also combined with, like, if there is concern about the child with the diagnosis, or I guess this could extend to the siblings as well, like if there is a family history of cancer and maybe grandma or grandpa died of cancer, like how can parents approach those situations where there are worries that the child has about the diagnosis and maybe their role or prognosis?
Yeah, I think one of the things I say first and foremost that I know Alyssa and I talk about is setting those expectations out loud, which may seem silly to an adult, that cancer is not contagious. It's not something you caught from someone else. It's not something your sibling, if you're a sibling, you're going to catch. And that extends into the classroom also. And then, like you said, there's nothing you did, whether you're talking to the child with cancer themselves or their sibling. I think it's important to say to both of them, there's nothing you did to cause this, and there's nothing your sibling did to cause this, or didn't do. And it's different than maybe your grandma or grandpa's cancer that you may have experience with. So really naming those things that I think sometimes are so obvious to us are important to say out loud.
Well, and I'm so glad you brought up that point of maybe it not just being the child who's afraid that they cause their own cancer, but I think, especially when there's younger children involved, I would imagine, I've certainly seen that, like with a parent has a cancer diagnosis and then the child is afraid, I was naughty or something like that. And so now that's why mom has cancer, but that could also be something that happens for a sibling. I was mean to Johnny, and so see what I did to him. I'm curious, Alyssa, any thoughts for yourself as far as how to approach those situations?
Yeah, absolutely. Well, echoing what Stephanie mentioned saying the obvious, saying it out loud, and allowing that question to be revisited in different ways. Children of a certain, that preschool, early elementary age need to be reassured and to go back to that you did not do anything wrong. Whether you're the patient, whether you're the sibling, even sometimes for the parent, the guilt that parents feel that they didn't catch
Sure.
something, again, there's nothing you did that caused this. There's nothing that anyone could have done to prevent it or make it go away. Saying that out loud is very powerful. And I second also what Stephanie was saying about putting space to talk about what you're worried about.
Mhm.
Let's hear what's going on with you. What are your wonders? What are your worries? And that's a great way to help that child identify what they're feeling or what they're going through. And then when you talk about it, it's less scary. You've identified it, you've shared it, we can move through it. So yeah,
Yeah.
talking is really the key.
Well, and I love that idea of checking in with kids about what their worry and what their wonders are. Because I know like even adults have a hard time generating questions. I mean, right? Like sometimes I find myself coaching adults on like, here's how to have a conversation with your doctor. So if I strip away 10, 20, 30, 40, 50 years off of life experience, you know, to turn to a child and say, okay, do you have any questions? I could imagine that some kids can generate questions, but that may be challenging for other kids. Which makes me wonder, like, how do you, like, how can a parent go about trying to assess or trying to check in with their children to make sure that the kids have the information that maybe they need? Is it about the worry and wonder? Are there other kind of ways to engage that are more, let's say, productive than others?
Yeah, I would say model what you're trying to engage or what you're trying to get back from your child. So, for instance, you might start a conversation by saying, today was kind of hard for me. I felt really sad. It
Mm.
really stinks that this is happening. And, I felt kind of bad about it. And maybe I had to sit for a minute and maybe I cried and that
Mm.
felt better. Or I went and I got a hug from, daddy or whatever that made that moment better for you. How are you doing? Do you ever feel sad? What makes you feel better? And just modeling that behavior really can engage that your child in such a different way rather than just asking a question that can be really difficult to answer, but asking it and modeling what you're looking for sometimes gives a nice path
Mm.
for a good conversation.
And I think that's a great way to check in emotionally. I think that's the number one thing, to encourage parents to model, like you said, to show, not just say, I want to hear from you how you're feeling, but to be open themselves and then really say it's okay to
Mm.
talk about. And then in terms of how do I know that my child understands what's going on,
Yeah.
I think there's a spectrum of that. And it's okay to recognize that's going to be different developmentally, depending on how old the child is. But sometimes I'll suggest that a parent might ask, if one of your friends was to ask what's going on or
Mm.
to ask you about your cancer, how might you explain it to them? And I think that's a great way to take the pressure off of, you're not quizzing them, but
Yeah.
to kind of get insight into how they're processing what's happening.
Yeah. Yeah. I love that. Like, because then you're getting that insight into how are they understanding
Mhm.
this without it being such a pointed question, right? I mean,
Exactly.
it seems like that softening the approach, whether it be role modeling and showing that, hey, these are natural emotions to be having, or kind of like a little bit of almost a role play, right? How would you explain this to your friends? Which makes me think about, I think, another topic that I've seen come up with the parents that I've worked with, which is school. Peer group. I think parents wanting to try to keep things somewhat normal, being concerned about their kids getting to have like childhood experiences. And so, do I send my kid to school? Do I not? What do I need to tell the school? Who should I talk up to at the school? Right? Like there's, you're beyond just that family system with a lot more moving parts. So, what are both of your general attitudes or guidance when it comes to handling school when a child's in treatment, maybe starting there?
I think first and foremost, I want to be clear to talk to the doctor. I think that's not always something a parent might think to do, of like, oh, does their doctor want to talk about school? And the answer is yes. And it's important conversation to have about medically what's recommended. And then after that, trying to encourage keeping that routine. It is so important developmentally, socially, to be involved with school if a child is able to be. And I recognize that might not be the case for everyone, but when they are able to, it is just like a home routine is important to keep. So is the school routine.
Yeah, and I also would say if you can keep your child in any portion of school, whether it's the morning and then they have to go home because their energy level on certain days isn't the same, that's a-okay. You want to be able to provide a routine in any way that you can. I also might suggest, if there is a way for the teacher and the classroom to have a conversation about what's going on with their classmate, so that there's a space for their classmate to learn how to be supportive. Some kids have never seen a child that's gone through chemo before, coming to school with a wig, coming to school bald or with a hat, that can be very scary for the other kids in the classroom who may not understand cancer, may have the same misconceptions that siblings might have about, did I cause the cancer? Did I say something mean? Can I catch it? So it's important, actually, kind of both ways, so that their peers can be supportive. And at the hospital level, most pediatric oncology departments will have a liaison to school, whether it's the social worker or a child life specialist that can, help with that school transition. So I think that would be another thing that I would advocate for, absolutely. Or if you're here with us and you weren't able to do that, we're able to contact the school as well, because it's so important to have that support in all areas of the kiddo's life.
And then what?
Oh no, go ahead, please.
No, I was just going to add that I know sometimes there's a hesitation from a child or a parent of not wanting kids to talk about it, or to say things behind a kid's back, or to be teased, or being worried about what our kid's going to say.
Sure.
And that can be a hesitation to share information sometimes. But I think I try to remind families that sometimes not sharing information is when kids tend to make up things more, and that when they don't have all of the information, that's when the rumors can go, or they fill in the blank. And so sometimes being upfront about what's happening can just make it, oh, it's very matter of fact, and then they move on.
Well, and two things come to mind. One is, I think, the message of, like, parents may be needing to advocate for this, right? In a best case scenario, the classroom teacher, the principal, the school social worker might be thinking to do these things. But if not, that may be something to be talking about with the school. I lost the other thing. I guess it wasn't that important. I also, just to back up for a moment, because when you guys were talking about school and the value of the routine, I kind of was left with the impression of like, that is the value of school, less so on like getting caught up with academic performance. Like I've known parents where they've been very concerned about like keeping their kid on track academically, and that causing a lot of stress in the family when maybe the expectations around academic performance were not realistic for where that child was at based on their treatment. So I mean, like, is the going to school about trying to keep them at their grade level? Is it really about the socialization and just having some kind of normal routine? Like if a parent presents and they're concerned, like, well, God, my child's falling behind in math, or, you know, not keeping up with their Spanish or whatever, like, what perspective would you guys take? I see Alyssa laughing a little there.
Well, I'm not laughing because that's such an odd expectation. It's very valid. And I would say you're the best expert in your child's care. So if you are under the impression that schoolwork is going to help with that child's self-esteem to continue to feel like a productive school-aged kid, that's their job. Their job is to go to school. Lots of kids like going to school. They like certain subjects more than others. And so there is that expectation that they should continue with what they like to do. Obviously, you temper it with what's happening physically and, physically for the child. If the child is in treatment, that takes first over anything. But keeping on with what you're learning, if your child likes it and wants to do it, it actually builds their own self-esteem and their own resiliency and gives them a little control, which in a healthcare crisis, children and parents and adults, all people, you don't have any control of what's going on with you.
Sure.
School can be a really positive reinforcement that you are a productive, important, growing, and a little bit of that normalcy back into your life. So it is a little bit of both. It's that routine, but it is about learning, because that's what your peers are doing. That's what most kids want to be like everyone else.
Yeah.
So it's a little bit of both.
And then on the flip side, I think sometimes you see kids who that's the first thing that they want to throw out the window, understandably, is school, right? And it can be hard as a parent to navigate, when do I push them and when do I not?
Yeah.
And I think, just like Alyssa was saying, you're the expert in your child. And I think 99% of the time what you're thinking is happening is spot on, but asking the medical team for reassurance too of, is this a point in treatment that typically kids have a hard time doing things like schoolwork, is always a good question too. And of course, it doesn't mean that that's necessarily going to be how your child experiences it, but they do oftentimes see hundreds or thousands of kids within that same treatment plan and may just be able to give you a better overall sense of what to expect.
Well, and I think what I hear too is there's a range, right? There's not one right or wrong answer. It really is like based on what that child's needs are. And it just made me think, I mean, I will say, disclaimer, I don't work with kids, so I'm learning here too with everybody listening. But it just made me think of like, how work can for some adults be such an important outlet and almost an escape. Like to feel like other parts of their identity get to be exercised. And it sounds like, the work of children is school, and that can be really important, just as much as for some adults, they can't work while they're going through treatment because they're too sick or, whatever's going on for them. You guys were talking about like just the value of maintaining routine and normalcy as much as possible. Normalcy, right? That's a moving target. What's normal? Chores, expectations around the house, right? And I feel like that's twofold, right? Because on one hand, it's what are the expectations for the child who's got the cancer diagnosis, who's going through treatment? Is that about backing way off? Is that about still maintaining some of those expectations? I think the other thing, I'm just going to pile this on here, is the siblings who aren't sick. And, I think what I often see is then there's more expectation on those children. So, how do parents navigate that?
Yeah.
I feel like as I finish my question, I feel like both of you like took a deep breath and are just like holding your breath, like, okay.
I think the reality is that sometimes we can tell families what we recommend and recognize that that just may not be possible for your family. So, like you were saying, trying to keep the consistency of parenting, how you would parent a child, whether it's the child with cancer or their sibling, consistent to how you would have before the diagnosis is so important when you can. And your whole world's changed. So of course, that's not going to always be possible, right? But I think in those moments where maybe you do have to ask an older sibling to babysit more or take on other responsibilities, if it's something you absolutely have to do, recognizing that, hey, I recognize that this is different and I wish I didn't have to ask you to do this, right? And this sucks. How is there other ways I can make sure that you're getting the support you need since you are doing more around the house? And just kind of being frank about it.
Yeah, and I would also say it's that open communication, and it really honestly goes back to how you presented what's going on. If you start off with information that's accurate and they know that trust is being built because you're telling them the information that you have when you receive it. And so you've already built that foundation of you can trust me. I'm not hiding anything. I'm being transparent. And so this is how our family culture is going to have to change a little bit. We have more doctor's appointments. Our after school has been, blown up, and what we normally can do, I'm not sure that I can. But because you're being open, because you're actually already having those conversations, not only just about check-ins emotionally, you're also checking in physically. This is a lot. We're doing so many different things right now. How is it going? Make that calendar, put up what's happening during the day so everyone feels like they're on the same page. Siblings are a special group of kiddos that can feel left out, can feel overworked, and it's great that there is a time to acknowledge that, like Stephanie said, and that's so powerful for those kids too, to just be heard that things are different for them and it's not their fault and it's not anything they did wrong. And if they don't like it, it's valid that they don't like it. All those ranges of emotions, angry, sad, guilt, scared. As long as we've got that open line of communication, it should be okay to talk about things they like and things they don't like.
Well, and it makes me think of I think if you're acknowledging something, I think sometimes adults can feel like now it's a problem to solve, and I can't solve the problem, right? I can't make it be totally different. So let's not even go there because I can't do anything about it. When sometimes the problem to solve is, does your child feel acknowledged and understood and seen in their experience? And if we look at it through that lens, then of course we want to normalize that it's okay to feel these ways, and it would be understandable if they were feeling any number of emotions. sometimes multiple emotions at the same time, right? That kind of emotional intelligence piece of this, that it seems like families kind of get a crash course on, if you will. When you, as you guys were talking, I was just thinking, like, so much of what we've been talking about makes me think of how we may talk when like an adult in the family has cancer.
Mhm.
And I'm curious about what you see that comes up uniquely, or that you think is important to speak to, that is unique to when it is the child in the family that has the cancer diagnosis.
Hmm. You know, it's hard because every family is so different. Um,
You can't just give me one universal answer, Elissa, that fits for everybody. What do you, come on.
yeah, let me get that magic sentence out. Um,
But can I, joking aside, I mean, I think that that's powerful message though,
Yeah.
right? Like there
Yeah.
is not one size fits all. Like that kind of keeping up with the Joneses is not going to work here. That you can't expect that what your experience is going to necessarily mirror exactly what another family experience relative to a child's cancer diagnosis.
I, I do think one thing that is particularly challenging about any kind of pediatric illness is just the lack of autonomy that kids have to begin with, and the fact that I think anyone it loses control when you have a cancer diagnosis, and that's even more so when you're a child and maybe not making your own medical decisions the few times
Sure.
that you have any decision. And so that need to create other ways to involve your child in decisions when you can, I think can become really important and an important thing to think about. And it might not be, do you want to do chemo? That might not be an option they have, but do you want to, we need to tell someone at your school about this. Do you want to tell the teacher? Do you want to tell the social worker? Who is it that you trust? And trying to say, doing this might not be an option, but there are options within how we do it, type of thing.
Yeah.
Yeah, and kind of to piggyback off of what Stephanie said about that control, sometimes, the intervention, there's no decision, you have chemo. But you can certainly involve your child in what worked best for you when maybe they're having an IV inserted. What worked best for you? Do you want to look at it? Do you want to look away? Is it helpful for you to watch a movie on an iPad? Do you want to hold my hand? Those little decisions that help them get through that small intervention does build their self-esteem. And it's kind of powerful to tell the nurse, you know what, I really like it better if you put that cold cream on me first. It numbs my skin and I do better. You gave them that power to be able to tell the nurse what works for them.
Yeah.
I don't want you to tell me when you're about to prick me. Some nurses like to count it down. I don't like that. Just the way it's going to happen. Just little things like that can give them some type of power while they're going through their interventions is really, really helpful. So that also might be something I would tell parents who are working with children who have that diagnosis.
Well, and I think what you're saying is so powerful, because I mean, I even think, like, I'm a parent. I'm not a parent with a child with cancer, but I'm a parent, and thinking about how easily I could just step in and take charge, and almost in some ways regress in my parenting style of going back to when my daughter was less independent and just making the decisions and stepping in and directing. Like, I think for those of you who know me personally, it probably comes as no surprise that would be easy for me. That the reality that there is that, I mean, it goes that feeling of being in control that can feel so limited. And we're not saying now they have any choice. It's like, it's like the equivalent of, do you want to use the pink toothbrush or the purple toothbrush? I'm not giving you tons of options, but I am giving you a sense that you are a active participant in your care. And so I mean, it's so interesting to hear that because I've never even thought of that, but I can think about, I could just see how easily a parents could just step into taking that lead role and not even thinking about, the benefit of involving their child in these ways.
Out of love, right? Because you as a parent have no control over the diagnosis. And so you want to be able to do everything you can to take control of it. So it's certainly understandable. But I think it's important to involve both.
So I'm looking at the time and I always say it gets to 45 minutes and I'm like, where did those 45 minutes go? So I'm going to ask you one question here finally, because I feel like it's the question I tend to hear the most from parents. And maybe that's just because of the way in which I interact with them, which is my child is wanting to spend more time at home. My child is wanting to be more with friends. My child is talking about how they're feeling all the time. My child is not talking to me at all. My child hasn't been crying. My child has been crying. Oh my God, how do I know that my child needs support? Because I can hear the exact opposite things from parents, and both of those parents think it's a sign that something wrong, something bad is going on with their child. How, yeah. You've got 2 minutes, go.
Well, again, I would go back and say, you're the best expert in your child. If you see that things aren't feeling good to you, that you recognize that your child probably would benefit from talking to someone who isn't mom or dad, then that's really your family culture, how you view your child. It's hard to say that there's just one thing that would say something's wrong. And also, sometimes there's a cancer diagnosis and your child is appropriately sad and appropriately scared, and that isn't bad. That's not wrong. That's exactly correct. Crying is a-okay when somebody in your family has cancer. That does not mean you irreparably harm them and they need to come in and see someone. It's great to talk about feelings, but crying and being sad is not a red flag.
Yeah.
It's expected and is developmentally appropriate.
I think sometimes it's hard to know when your child might benefit from talking with someone outside of yourself. I think creating the openness that we've been talking about, the open communication so that they can, if they want to, talk to you as a parent is great. And also from the very beginning saying, there might come a time where you don't feel comfortable talking to me. And that's okay. I just want to make sure you have someone to talk to. So let's figure out who that's going to be. So that way, if you don't want to talk to me or either of your parents, that you've got someone at school, at the Cancer Wellness Center, wherever it is that I know you feel comfortable talking to if that time comes.
Yeah. Yeah. I mean, the value in choice. Right. Well, we could keep talking, but the clock is telling me that it's time to say thank you and goodbye. Any, just as a final check-in, just closing thoughts. You have, your 2 or 3 lines of what you could communicate. What would you want people to be left with here? Yeah. Sum it up.
Yeah.
Write the great American novel in 2 to 3 lines.
I think I come back to the statement all the time. You're the best expert in your child. Open communication, plain simple language, and a space to have those, tough emotional conversations, and know that you are supported. There are places for parents to get help, even if it's just calling to get guidance on a conversation. Sometimes that's all you need, and happy to provide, happy to support you in that way.
Absolutely. There are hundreds of pediatric oncology resources. I would never want a parent to feel like they have to do this alone. It's okay to use those regardless of your situation.
Yeah. And that's, I think, regardless of economics, social
Mhm.
class, right? This is
Absolutely.
a
Now is the
challenging
time to use
situation.
them.
Yeah. I think another resource I'll also put out there is that we are lucky enough that we are going to be starting a parenting group for people who have a child with a cancer diagnosis. So if you're listening and that's you and you'd like some peer support, it'll be a professionally facilitated group here at the Cancer Wellness Center. So I want to thank my guests here today, Alyssa and Stephanie. Thank you so much for lending your time and expertise to today's conversation.
Thank you for having us.
Yeah. So I will be back here in May. We're going to do something a little different in April. My colleague Nora Barquin will be doing a staff chat in Spanish, but I will be back here in May to talk with somebody about clinical trials, and I welcome you to join me. Thanks for being here and joining us either live here, live on Facebook, or if you're watching on YouTube. Take care. Take care, everybody.
Thanks.